Good afternoon, everyone. We recommend 6 downloads from our website, oxytocinmeasures.com. If the menu is not displayed on your system, you can reach the article by adding /publications. For the other individual downloads, add /downloads to the URL. Postpartum hemorrhage and synthetic oxytocin dilutions in labour is our article published in October's British Journal of Midwifery and followed by our citations. Oxytocin figures and tables are the 12 illustrations in the article. They are free to discuss and use in your work. Effects of excessive blood loss covers long-term issues. Calculate allowable blood loss. We suggest making an estimate in the case notes at 36 weeks of pregnancy using current weight and hematocrit, although we know hemoglobin will fall as the fetus starts to store iron. Presentation Oxytocin, 14th January 2021, is a comprehensive PowerPoint followed by reflective questions useful for continuing professional development. Figure E, Table of Dilutions, includes licensed and unlicensed. These downloads are hyperlinked in the following slide. Downloads. How to calculate allowable blood loss. First, go to www.manualsweb.com/blood_loss.htm. Use an average weight in pounds or kilograms. For hematocrit, choose a number around 40 for average healthy pre-pregnancy blood volumes. During pregnancy, hematocrit will fall in line with increasing blood volume. Anemia and poor diet should be corrected if possible. Write down the allowable blood loss for 40, then with the same weight choose a lower hematocrit to compare. The allowable blood loss falls accordingly. Now alter the weight for a smaller stature. Start with hematocrit around 40 and compare with the first calculation. These factors play into individualized care. At hematocrit 30, there is no allowable blood loss. Challenges to homeostasis. Apart from hemodilution, there are other challenges to homeostasis during labour. These include pre-existing or enduring health conditions, the challenges of pregnancy itself, and any complexity that develops. What is homeostasis? Taken from the Greek words for same and steady, it refers to any process that living things use to actively maintain fairly stable conditions necessary for survival. Homeostasis is your best friend, because against all odds, the woman's body will do all the work of managing her labour as long as its natural rhythm is supported and not disrupted by unnecessary interventions. Unlicensed regimes of synthetic oxytocin and other factors have influenced the steady rise in hemorrhage rates since the 1980s that could be reversed by practicing as standard with the original licensed instructions from 1977 that still pertain today. This slide shows the instructions to induce or enhance uterine contractions. The summary of product characteristics covers the other uses, contraindications, side effects, and that continuous medical supervision is required. Palpate contractions after infusion rate changes up in case the new dose is too high. Administration of synthetic oxytocin. The instructions are for drip infusion, where 1 ml contains 20 drops. The time on the clock and number of drops per minute are recorded in notes at the start of each new rate. Infusion pumps need logging of the volume to be infused over a preset time period. First, offering up to 2 decimal places after the point in accuracy. 20-minute time segments promote logging safety with simple numbers. The instructions permit rate changes after 20 minutes, not excluding fine-tuning by 1 drop 0.05 ml containing 0.5 mIu down or up. Fine-tuning the infusion rate. The length, strength and frequency of uterine contractions must be used to guide the tweaking of infusion rates, giving endogenous oxytocin time to chime in and adjust to synthetic oxytocin's presence. Each drop, 0.05 ml, contains a therapeutic dose adjustment, whether 0.5 milli-IU, which contains 0.00083 micrograms, or 0.25 MIU, which contains 0.00415 micrograms. These tiny doses are sufficient because only 1 milligram contains 600 international units of synthetic oxytocin. Total rest between contractions must exceed 1 minute for adequate homeostasis to persist. Pump error factors. The manufacture of intravenous volumetric, also known as peristaltic, infusion pumps allows slippage of up to plus or minus 5% accuracy, depending on the setting and rate in use. Very slow rates slip it towards plus or minus 10%. For syringe drivers, the range is plus or minus 2%. These possible variations are totally mitigated by using the licensed dilution and by titrating the infusion rate, that is the dosage, with the contractions. The bolus function should be disabled for any infusion of an unlicensed dilution for safety. Unlicensed uses of synthetic oxytocin. Intramuscular injection of greater than 5 international units. For example, intramuscular injections of 10 international units, 20 international units, or 30 international units in theatre following caesarean section. Dilutions for intravenous infusion stronger than 10 milli-IU per ml for live pregnancy. Bolus intravenous injections of any dosage over any time period, for example 20 minutes, for any reason, including postpartum hemorrhage. (2001) The Unlicensed Advice. In postpartum hemorrhage and synthetic oxytocin dilutions in labour, Figure A is the Royal College of Obstetricians and Gynecologists, RCOG, suggested dilutions and infusion rates with their comments. Budden et al. 2014 observed that from the 1980s, increments were limited to 1 milli-IU per minute, thus abandoning the unmistakable option of fine-tuning by 0.5 milli-IU found in the license instructions that is essential for blending the infusion with natural oxytocin to maximize the benefits of homeostasis. In this slide, Figure B from our article shows the RCOG's regime highlighted in blue. Unlicensed increments of 4 milli-IU at a time jump up to an unlicensed maximum of 32 milli-IU per minute. 33 additional fine-tuning rates are omitted by the blue regime. Licensed increments are 2 milli-IU or lower, with a maximum licensed of 20 milli-IU per minute. Pain relief. After the RCOG's advice, the offer of epidural pain relief prior to synthetic oxytocin infusion was standardized. With the recommended dosage range, a greater choice of pain relief is available. Tips managing synthetic oxytocin in labour. Please check out this short list of traditional core midwifery skills for labour management to maximise opportunities to detect concerns about the contractions, the fetal heart, and prevent PPH if at all possible. Implications for practice. The evidence that midwives can obtain better outcomes for their patients is in the current statistics for PPH and perinatal deaths. Within parameters that evolve through clinical research by careful obstetricians, synthetic oxytocin can be infused safely. It is simple and effective, a delicate undertaking necessitating professional one-to-one care as defined by the 1977 directions. Clinical justification for recommending unlicensed regimes is hard to find in practice. Consent from the intended patient should be obtained for all uses because this treatment causes pain. The lowest possible dosage rate should be determined during established labour and discontinued before delivery. This reminder ends our presentation. If your questions are unanswered today, please email admin@oxytocinmeasures.com. Thank you.